Hey, future medics. Today we are talking about abdominal quadrants and pain patterns. And this is one of the fastest ways to narrow down what's going on with your patient before you ever put hands on them. If somebody says that they have abdominal pain, that could be about 20 different organs. It's not incredibly helpful. But if they're more specific and say right upper quadrant pain, left lower quadrant pain, now we know what organs live there and what could possibly be going on so we can start working towards a differential diagnosis. To accomplish this, we divide the abdomen into four quadrants. It is divided medially, which goes through the belly button, through the entire body, and then also horizontally going through the belly button as well. We divide into the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Important to know that this is always based on the patient's left and right, not yours. Okay? So dividing them up this way helps us divide up organs, make it a little easier to remember where things are. Let's start with the right upper quadrant. Here we're going to find a majority of that liver, part of the pancreas, the gallbladder, the duodenum, and part of that right kidney. Now, a pain pattern that we often see here is when they have this right upper quadrant pain, it is often gallbladder, liver inflammation, or duodenal ulcers. So, for example, if someone tells me right upper quadrant pain radiating to the right shoulder or the back, I automatically am very suspicious that it's the gallbladder, especially if they've had a very heavy carb or fatty meal within the last hour. Let's look at the right lower quadrant. Here we're going to see the appendix, the small intestine, part of the large intestine, and in our female patients, the ovaries, the right ovary specifically. So whenever we see pain here, it's very common for it to be appendicitis, especially if it's rebound tenderness or started in the belly button and then moved to that lower right quadrant. It can be a cyst, an ovarian cyst or torsion, or it can be a bowel obstruction. So a classic EMS example that I would see would be pain in that right lower quadrant that has rebound tenderness, and I would say appendicitis. That's my differential off the bat. Looking at that left upper quadrant, we're going to see the stomach, the spleen, part of the pancreas, and the left kidney. So pain here is often gastritis or ulcer, pancreatitis, could be a splenic injury. So a classic EMS example that I would have is pain in that upper left quadrant following very directional traumatic injury with pain in that left shoulder. That is splenic injury. And the spleen bleeds out quickly. So be very careful with these patients. Finally, the left lower quadrant. We're going to see the descending colon, the sigmoid colon, and in our female patients, an ovary, the left ovary. So pain in this left lower quadrant is often diverticulitis or constipation, could be torsion or an ovarian cyst. So a classic EMS example could be pain in that lower left quadrant with fever and diarrhea. That's diverticulitis. That is my first differential that I think of with that pattern. Internal organs share nerve pathways with surface areas on our body, which can lead to referred pain, which presents whenever a patient has pain, maybe in the left shoulder, that is not where that organ is. So for example, the spleen in the upper left quadrant refers its pain to the left shoulder. That is called Kerr's sign, and that's a splenic injury, even though the spleen is very much not up here. In the right upper quadrant, we have the gallbladder, which refers pain to the right shoulder or to the back. The kidney is often referred to the flanks or to the groin. So when you're assessing your patient, ask if the pain moves anywhere or radiates from one spot to another spot, and it'll help you narrow down which organ it could possibly be because only a few of them will do this. Knowing all of these things is important because it tells you what questions to ask, where to start your palpation, what you can expect to find on your assessment. But also, whenever a patient tells you that they're having pain and they point to their lower right quadrant, you can already have a short list of organs in your mind which could possibly be involved, which helps you narrow down what's going on with your patient quicker and get to the solution for them faster. I know this is a lot, but you're going to get it. You're doing fine. I believe in you, even if you don't believe in yourself right now. I'll see you soon.